Hello and welcome to our podcast series, Conversations with KidsPeace. I'm Bob Martin. As we record this, the holidays are just around the corner, and isn't that the time to celebrate families? Well, it is, but that's not what we're going to do today. Instead, we're going to talk about family therapy and the role it plays in helping kids overcome mental and behavioral health challenges. And to do that, we're welcoming two of our favorite guests, Adrienne Pauling and Michelle Callahan. Adrienne is site supervisor of the acute partial program at KidsPeace's Broadway campus in Fountain Hill, PA. And Michelle is facility director for KidsPeace's drug and alcohol treatment programs. Hi, guys. Welcome back.
Hey, Bob.
Hey, thanks for
us.
having
We'd love to have you here. So Adrienne, let's dive right into it. How is our understanding of the genesis of mental illness changing, and what does that mean for family therapy?
So first, I think it's important to think about, we pass things along to our kids, not just our blue eyes and our brown hair and our short stature in my family situation. But we can also pass along mental illness, and we can also pass along things that have happened to us in our past, and our behaviors in turn can cause issues within our children in the home. So it's very important to understand a family dynamic and to get the parent's point of view of what's happening with their child.
Michelle, what are some of the common misconceptions that parents have about mental illness treatment for their children?
You know, I have a list, and I just kind of thought of a different one I should probably start with, which is KidsPeace only serves children. I guess about 6 years ago, we created this umbrella name of Orchard Behavior Health, and we started serving the adults as well in our outpatient facilities. And the reason we decided to do that is we're serving these kids and adolescents, and we found, wow, these parents need help too. And today, many years later, some of our programs are split literally down the middle between over 18 as the clients and under 18. And I mean, in some of the programs, we have the parents, 3-4 of their kids. Sometimes we even have grandparents. So that would be the first thing that just kind of popped in my head to mention, is that KidsPeace doesn't just serve children. I think the biggest thing when Adrienne and I were talking about some of the common myths that we hear is there's this mentality from the parents that the kid is the problem lies specifically and only with the kid. There's this idea of fix my kid. That has to be hands down the biggest one. And I think that goes back to psychoeducation. You only know what you know. The kid is probably the one acting out behaviorally. Mm-hmm. I think another one we hear is, I have a bad kid. And again, surface level, maybe the kid is acting out, but what is the kid really trying to tell the parent? Sometimes emotionally, they don't know how to express what's going on with them, or how, the changing family dynamic is affecting them. And that affects every family member. And on the other side of that, I think we also hear, the misconception of I'm a bad parent. Mm-hmm. That's a big one too. And honestly, 9 out of 10 times, my perception is the parent is doing the best that they can,
right,
with the resources they have, or the lack thereof as far as the resources they have. So that's a big one that we see. Another one we mentioned when we were talking about this is we see a lot of the blaming the other parent, especially if they're not together anymore, blaming the system, blaming the school, teachers, or just finding anyone else to blame, really. And sometimes, again, that goes back to, they don't know their role maybe in that. And it's easier. And I think as a parent, it's really hard, even if you do realize that, maybe there is a problem that lies within you, or maybe you could do something better.
Right.
So that's when we hear. And then, another one is divorce ruined my family. And honest to God, sometimes divorce can be the best thing that can happen to a family. And it's really the events that are leading up to a divorce, the fighting and the animosity that can happen with parents. And
it's that old thing of I'm blaming the symptom, not the underlying disease.
Yes.
Right, exactly. And, and you can completely appreciate that parents want to stay together for kids, mm-hmm. But sometimes that's not the best thing mm-hmm.
In
their interest. And, fighting starts to happen in front of the kids, and, that takes its toll as well. And then you have kids who sometimes will blame themselves in return.
Right.
So those were some of the most common myths that Adrienne and I had talked about.
Yeah. And it's interesting because I was thinking about this as well. And when I've discussed this with experts like yourselves, I often hear this phrase that it really resonates with me. It's hurt people hurt people. And to your point, I wonder how many of those parents are actually not realizing that their kids may be going through the same thing they went through, they themselves went through when they were that age. And I guess that goes to the question, Adrienne, let me ask you, how hard is it to get a parent or a caregiver to consider their own situation as you're trying to help their child?
It can be very difficult. We do see a lot of resistance, and we also see parents that come in and say, listen, I had a terrible childhood myself. I did not have good role models. I didn't know how to be a part of a family. My parents never told me I loved them. And I think that this is the reason that maybe my kid is acting the way that my kid is acting. And it's a trickle-down effect. If you were raised in a home where your parents didn't tell you they loved you, or your parents were constantly fighting, that becomes a norm for you. And if at no point you received help or no one intervened in your situation, you only know what you know. And so it's important for us to understand that this is what happened to the parent. During our assessment phase of treatment, we get a family history, we get a mental health history, we get a drug and alcohol abuse history, we get a history if there's attempted or completed suicides in a family, we get history of incarceration in the family. And then we empower the parent to just be open and honest and use the skills that they have and the skills that we're going to give them to make things better for the next generation.
Well, let's dive into that a little bit more closely. When you've gone through that assessment and you're looking at therapeutic approaches that you're addressing to the whole family, how do family therapy approaches address the dynamic and move everybody towards a more healing type of situation? And let me start with you on that.
So first and foremost, it's essentially a puzzle. So you're getting all of the bits and pieces during the assessment phase, and then we as therapists put the puzzle together in our mind, and we start from there. Family therapy is designed to be a safe space for everyone to be heard, and sometimes it just starts with basic things like boundaries. So you're setting boundaries. No, you cannot be on your tablet 6 hours a day. No, you do not have free reign to leave the home whenever you want to without permission. A lot of times the word no is a big deal because sometimes when parents are hurt themselves or don't have the skills, they overcompensate by allowing things to happen like leaving the home or using the tablet or doing these things that there should probably be restrictions on. And then when you try to establish a restriction, that's when you might just start to see some of the behaviors.
And imagine how hard it is to put that puzzle together when you're missing pieces. And you really need like every member of the family or as many as you can to be involved in order to put that picture together correctly, because otherwise as therapists we're taking a shot at the full picture of what exactly are the underlying issues to the surface level stuff that we're seeing.
Yeah, you're looking through a keyhole that's provided to you, and you have folks that may not realize their own behavior has contributions to this, may not be real open to admitting it to another person or even to their child. Or maybe they look at it through the prism of their own experience and say, that's not that bad. Why are you doing this? And I know you guys hear this all the time. You look at situations and behaviors emerge from triggers that for a lot of people would go, why are you choosing to fight on that hill? Like, why not let the kid use the tablet, or why not give them a little bit more freedom? And you're having to say, no, you have to think about these things a lot more sort of holistically and try to get that going.
There's also a lot of steps sometimes that we need to take as therapists before we're even putting the whole family together in a room. Sometimes, we put them in together and it's like, okay, this was not the first step to take. And first and foremost, like usually the kid is our primary client. And, you have to build rapport, not only with the kid, but with the family, but usually with the kid first. So sometimes it's most appropriate to maybe do some individual therapy and build rapport with the kid. And then we also do what's called collateral family therapy, where you meet with just the parents without the kid. And that's where I think sometimes you can start with putting the puzzle pieces together. Because also a lot of times the kids may be more comfortable to start sharing some things individually first. They may not feel safe to, talk about some things or, bring up some of the stuff that's going on in the home with the whole family, and that's kind of where you can kind of open up those gates. And same thing with the parents. Again, like, it's a safe place, like she was saying, to give them a chance to talk about things from their perspective and not have to worry about what they're saying in front of the kid. And then you can bring the family together in family therapy all in the same room, and you got to really talk about what is family therapy, especially if they've never been in family therapy before. What are the expectations? What are rules? Grounds for family therapy. We're talking about some difficult things, some difficult emotions and behaviors.
Well, let's talk a little bit more about that. What are some of the approaches that our therapists are taking when it comes to dealing with family dynamics?
KidsPeace offers, like I was mentioning, we do serve adults. We serve the whole family in our outpatient facilities. We also, like you had mentioned, we're doing drug and alcohol services now, which is brand new for KidsPeace. So unfortunately, co-occurring issues are very prevalent, especially with the parents. So now we have the ability to address that in the parents, and we're taking as young as 13, even if the kids are having drug and alcohol issues themselves. We have some great autism-specific programs, and I know one of the things they offer is a parent-specific group. Right. What else?
Well, I just want to play on that too. We have people that are coming to therapy because they're recognizing that there's a need for it. But there's also people who are coming to therapy because maybe a school's putting pressure on them, or maybe another family member is putting pressure on them. And sometimes our parents don't understand mental illness. And sometimes a child with something like an autism spectrum disorder or a bipolar issue or mood disorder, things like that, sometimes it's not culturally accepted to get mental health treatment, and sometimes it's just something that parents don't know anything about because they've never had to deal with it. So bringing them in for family therapy helps them understand the process and what we're actually treating. We do offer PCIT treatment as well.
Yeah, can you talk a little bit more about that? Because I think that's really kind of a fascinating thing. And Michelle, you and I were together at the opening of our office up in Mount Pocono.
Yeah.
And they had this is kind of a thing, and I want you to explain it, but it's sort of a thing where you kind of have to have a specific sort of setup.
Yes.
Right? So what is it? Parent-child interaction therapy. What's involved with that, and how does that work?
So we offer that in 3 out of 4 of our outpatient facilities. Like you said, Mount Pocono is the newest, and it's an evidence-based program specifically for 2.5 to 6 years old. And the idea of it is, you're addressing the maladaptive behaviors or emotional difficulties of the younger kids while increasing the positive behaviors. And it's really neat. As the therapist, I am on one side of a one-way mirror wearing a headset. And then in the other room that I'm looking into that only I can see into because they can't see back, the parent is wearing an earpiece and they're in there with their kid. And I am actually coaching them through their earpiece and how to interact with their kid and how to address the behaviors that are coming up. And they even have a timeout room in there. So if a behavior does come out, they know how to address it. And also going back to praise. Sometimes the parents don't know how to adequately praise their kid. And then if people are consistent with it, it really works. It's homework. You got to go home and then actually use that at home with your kid. That
was one of the interesting things about that was, we have the setup and you go all that, but part of PCIT that's really important is you have to go home and manifest these same positive activities and then come back and talk to us about it.
Yeah, and it's a commitment. It's not for everyone, but they've seen some great success with people who are committed and are showing up, going home, doing the homework. We've seen some real changes in the kids that get to be a part of that program.
And I think there's something, Michelle, I think you said, sort of giving parents more of a perspective of, things that can work, things they can do, more control over the situation. I think as a parent, I would think one of the biggest questions I have is, well, what can I do? Right. Unless I have some experts like you guys telling me, well, these are some things that will work.
Right. You only know what you know.
I only know. Or what I'm able to find somewhere from a friend or from the internet, which is a horrific idea. Well, let's talk a little bit about, aside from the therapeutic approaches, Adrienne, what are some of the other ways that KidsPeace addresses the needs of the family as they're addressing those concerns about the child?
So a couple things. One, our walk-in assessments. So our walk-ins are offered 9 to 5, Monday through Friday at all of our outpatient locations. You can bring the child in. The therapist gets kind of a brief assessment of what's going on and then refers to an appropriate level of care. I run the partial program in Bethlehem, and it's a 10-day treatment program where it's primarily group therapy. There is individual and family therapy, but a lot of times kids come to me because they need a referral for a family-based or a multi-systemic therapy level of care. And those recommendations have to come from a psychiatrist, and my program can offer that. Family-based services is a team of typically 2 people. They're in the home 2 to 3 times a week. They're doing intense therapy with the family. They're addressing the family dynamics. They have ability to be available for crisis situations, on-call type stuff. And multi-systemic therapy is another approach to that, where you're essentially addressing the systems around the child. So the peers they're hanging out with, the family dynamics, those sorts of things, and kind of changing the things around them to encourage the child to change as well.
I think that's one of those things of saying there is help. It is not an insoluble problem.
And there's no like one answer as far as how to address a family dynamic or something that's going on. And one of the nice things that we offer is a variety of therapists that are trained and certified in different things like trauma-focused cognitive behavioral therapy. There's a lot of generational trauma going on that maybe the kid and the parent, the whole family needs. I went to a year-long training with 2 of my therapists called ESFT, and it was a fantastic training about like really building rapport with the parents and understanding the truth of their distress. Sometimes, again, like you have that misconception of the parent being a bad parent, and maybe, we're quick in this world of the stigma of mental health to label them as that. And then, we have to get away from that question of what's wrong with you and ask, what happened to you. And that is such a powerful thing. I mean, just to be validated as a parent and be like, wow, no one cared enough to ask me what I've been through or what my role was in this. So we have, people trained in that and attachment-based therapy. I mean, is there anything else I'm missing?
Yeah, I think you nailed it.
Yeah, there's a bunch of different kinds of
I think it's so important, that point you made is that there's not just one path. There's not just one recipe. No. There's a whole bunch of things that could be done. You need to talk to folks who can basically help you, guide you to where that is, and then that are able to provide that in a appropriate therapeutic, evidence-based, trauma-informed way.
Yeah, absolutely.
And that's one of the things we obviously at KidsPeace pride ourselves on.
Yeah.
And this. It is always fascinating to talk to you guys. So, okay, you know the drill. We ask each of our guests for a life hack. This is a favorite saying, information from an inventor that you found useful, maybe just a tip on how to do something around the house better and everything. So I think I'm going to start, Adrienne, let's start with you. What's your life hack today?
So I have 2 things since we're approaching the holidays, 2 things. So one's kind of quirky, but the other one is kind of geared towards kids and situations that we may see coming up with the kids that we treat. So first of all, Thanksgiving, it's approaching rapidly. And I recently discovered on the internet a really simple thing to do to help you out. I have a very small kitchen. So taping your recipes to the cabinets so that they are at your eye level. And as you are cooking, you're not running over to your phone or flipping the page back to the book. You're not taking up counter space. Tape them to your cabinet. It's right there. Look up. Now you know what you're doing.
It's funny because when I was looking for one of the things I saw was taking a cookbook and using like a pants hanger to keep it open and then hanging it from the cabinet. So just to play off of her life hack.
And then the other thing I just wanted to say, I know this goes around on Facebook, but with Christmas approaching, and some of our kids not as fortunate as our other kids, I would encourage parents who are able to afford things like computers, laptops, tablets, high price items, to maybe steer away from saying that those items are from Santa and instead saying, Mom and Dad also got you a special gift. These gifts are from Santa, so that when they go to school and say, Santa brought me a tablet, maybe some other kids who are less fortunate aren't feeling like, well, what the heck? Why didn't Santa bring
Yeah,
me a tablet?
weren't I good enough to get one of
That's a
those?
great
And just
point.
kind of not, broadening the gap anymore between some kids that are less fortunate and kids that are lucky enough to be able to have those things.
And it's a great lesson, I think, going forward too, about, there are kids that may not be as fortunate as you are. Not to say you should feel guilty or
not at all.
You shouldn't, have these things, but have in mind that other folks, may not be that fortunate. I think that's a wonderful lesson.
Say it's from grandma and grandpa. Say it's just from mom and dad. We wanted to get a special gift for you. Something like that.
Okay. All right. Michelle, how about you?
Adrienne's always hard to follow.
I know. She's like,
She usually does go first. So I'm not going to lie. Like every time we do these podcasts and I know I need a life hack, I go on the internet and I Google and I'm looking for something and I usually land with like quotes more than something like that. And it's funny because I came across this article that was kind of like almost debunking life hacks a little bit. And I wanted to read the what I had read. It says, in our hyper-competitive world, a life hack is more narrowly defined as the perfect shortcut, a method to achieve a good outcome with fewer resources. It's the seductive idea that if only you could find the trick, you can accomplish your goals and just be happy. So it made me kind of think. And, one of my favorite quotes is, life is what happens when you're busy making plans. And I kind of feel like this is a life hack in itself, in a sense that I think we always need to remind ourselves to take a step back. And I'm a big person with like mindfulness and just kind of be in the moment. And I think like, especially as we're approaching the holidays, like that's really important. We're always on the hustle and bustle of, buying gifts and, prepping food and just really allowing yourself to be present in the moment and enjoy that time with your family. And that I think is going to be the source of happiness. That they're kind of referencing in a life hack. And if you don't like your family or you don't think it's going to be positive for you, my advice is to binge watch something on Netflix, and it's called self-care.
Well, this is why
She
you
hacked
guys.
your life hacks.
She lacked. I know, and this is why those who have seen our podcast before with our two guests know that I'm usually tasked with getting the right kind of headgear for this. I think I have this for what you just did to our life hack idea.
Okay, I'm excited.
I'm going to put on my hard hat. I should have had this at the beginning.
The life hack is under construction.
Exactly. I'm afraid something's going to fall on me with you guys. Michelle Callahan, Facility Director for KidsPeace's Drug and Alcohol Treatment Programs. Adrienne Pauling, Site Supervisor of the Acute Partial Program at KidsPeace's Broadway campus in Fountain Hill. Ladies, I'm convinced the only thing you can't do is disappoint. Thank you for being with us
Always
again,
a pleasure.
and we would
Thanks
love
so
to
much.
have you come back.
you.
Don't stay away too long. So, information on the offering, I'm going to take this off now. Information on the offerings of our outpatient programs here at KidsPeace can be found at our website, kidspeace.org. The Conversations with KidsPeace podcast is produced by Robbie Allred. I'm Bob Martin. Thanks for joining us. We look forward to having you join us again for more Conversations with KidsPeace. Take care.